Next part, caries of enamel or initial caries. First, initial caries. This is first part of caries of enamel. Initial caries is focal subsurface demineralization of enamel, which is characterized by loss of natural shine, color change in the form of a chalky or pigmented spot. And there are two forms of initial caries. First one, white spot, and another one, pigmented spot. And there are white spot lesion, early tooth decay. According to international classification, it corresponds to the code K02.0 caries of enamel or white spot initial caries. As for its characteristic, K02.0 caries of enamel is focal demineralization, it is chalky, and it's subsurface caries, and it has acute curves, and it is called acute caries. As for its outcomes or results of curves, there are three options of outcomes. First, recovery or healthy tooth. Second, pigmented spot. It may become pigmented spot, and as a result there may be formation of a caries cavity. First, recovery, second, pigmented spot, and third, formation of caries cavity. Characteristic of pigmented spot. According to international classification of disease, it corresponds to the code K02.3 and it is called arrested caries or pigmented spot. It is chronic or stable initial caries and surface spot, pigmented spot, and it has only one outcome or result, only formation of caries cavity. Pathological anatomy of caries in the spot stage. The lesion has the shape of a triangle, the base to the surface of enamel. According to Silverstone and Sinitsyn, there are several zones. First, healthy enamel zone. It's inside of triangle. Next zone is called transparent zone, and it has 1% of micropores. Next zone, number 2, is dark zone, and it has from 2 to 4% of micropores. Third zone, zone number 3, is lesion body, and it has 25% of micropores. And the superficial zone, zone number 4, is surface zone, and with 5% of micropores. Initial caries is the result of demineralization, and its increase of the micropores from 0.1% to 20% in the surface layer of enamel. A layer of Darling surface acquired dental layer, the result of physiological enhancement of mineralization, and its remains at the initial dental caries. During initial dental caries, layer of Darling remains. As for clinical manifestation of initial caries, there are basic and additional methods of diagnostic. We use both basic methods and initial. Basic methods. Complaints during initial caries. Patient may has no complaints, or it may be aesthetic defect, a feeling of soreness of the mouth. As for anamnesis, there is time of appearance of caries spot. We find out when the caries spot appear. Or identification of transferred and concomitant diseases. During inspection, we estimate spot color. It may be white, and in this case there will be the diagnosis K02.0, and it may be pigmented, and it will be another diagnosis K02.3, arrested caries. Also, we pay attention to the number of spots. It may be several or more often single spot. Also, localization. For caries, it is characterized the localization on the neck, on fissure or contact surfaces, and also presence of plaque. Next method is probing, but it is not performed because the enamel may be broken. As for percussion, it's painless. Additional methods of diagnostic during initial caries. Vital staining. Due to an increase in micropores in the demineralization focus, and we use methylene blue 2% or methylene red 0.1%. Drying. During drying, the size of made spots increases. Next method, trans illumination. It's darkening of hidden lesion. Electroodontodiagnostic corresponds to the norm, about 2 to 6 microampere in the frontal teeth, or from 2 to 20 microampere in posterior teeth. Luminescence is damping of ultraviolet rays. Differential diagnostic of initial caries. There are two main diseases which is similar with initial caries. First disease is fluorosis, and there are some general clinical signs. They are similar because of presence of chalky spots on the surface of enamel with a smooth, shiny surface. And distinguish signs. There are differ because during fluorosis only permanent teeth are affected. Also, spots appear in the places not typical for caries, and multiple spots arranged symmetrically anywhere on the crown of the tooth not stained with dyes. The next disease which we have to differential diagnostic to provide the differential diagnostic is hyperplasia. And between hyperplasia and initial caries also there are some general clinical signs. Both hyperplasia and initial caries is on the enamel surface. There are chalky spots of various size with a smooth, shiny surface. And as for distinguishing signs, during hyperplasia only permanent teeth are affected. The spots are located in the areas that are not typical for caries, in the convex surface of the tooth, in the area of hillocks, and characterized by strict symmetry and systematic damage to the teeth, respectively, the timing of their mineralization. The boundaries of the spots are clearer than with caries, and also spots are not stained with dyes. Treatment of initial caries. As for white spot, we use remineralization therapy. If there is compensation for the loss of mineral components of enamel is performed by applying medicinal substance containing calcium or phosphates to the surface of teeth. For example, it may be calcium gluconate solution 10%, calcium phosphate solution from 5 to 10%, solution of calcium glycerophosphate from 2.05 till 10%, and solution of Remodent 3% concentration. And also we may use calcium phosphate containing gels. And the course of remineralization therapy consists of from 10 till 30 applications. As for treatment of pigmented spot, it may be grinding with subsequent remineralization therapy and dynamic observation.